Hello, and thank you for joining us. My name is Yoko Nakagawa, and I'm Business Development Program Manager at Drummond Group. I will be moderating today's session. Joining me today is Dr. Feliciano Pele Yu. Pele is Chief Medical Officer at Arkansas Children's Hospital, and Timothy Bennet. Tim is Director of Strategic Healthcare Initiatives at Drummond. Today, we will be discussing why EHRs should consider the Pediatric Certification Program. This event will be approximately 30 minutes in length. If you have any questions, please share them via comments. We will save 5 to 10 minutes at the end for live Q&A. So Paley and Tim, how did you meet and start working together on children's health initiatives? Paley, would you like to start?
Yes, thank you, Yoko. Hi, Tim. Great to see you.
Hey, Pele.
Yes. So I think Tim and I met at one of the Pew Charitable Trust event where we're looking into the 21st Century Cures Act pediatric requirements for health IT. And, I thought I found someone who is as eager as the rest of the pediatric community
Hmm.
in trying to figure out how we could move the agenda forward for a really truly well functioning health IT or electronic health record that serves child health or children. Um, and so I was very excited with that. The reason why I was very eager is that for the past, I would say, 2 decades, even before Meaningful Use, the pediatric community has been very strong advocate for making sure that the electronic health records also work for kids, right? So the kids are not small, teeny tiny adults, but physiologically they're different. So the care systems that help support the care team and the patients in the pediatric community will need to consider those physiologic differences and then the treatment differences that are associated with that. So we're very eager, to talk about with Tim.
Yeah, and so at Drummond, we had been testing health before the Cures Act. We'd been testing health IT software as part of the ONC certification program since, I don't know, 2010, and we were very keenly aware that because of the incentivization model that was used to promote adoption of health IT, EHRs, digital health records, that in some cases sort of pediatrics got left behind because they really weren't incentivized to do so. And so we were kind of aware that child health and the digitization of EHRs, particularly in the pediatric space, was a little bit lacking. And so we were excited when it was coming out in the Cures Act, and a focus was put on pediatrics. And so we definitely wanted to. We decided right then and there that we felt like child health deserved better than what it had gotten thus far in electronic health records, and so we wanted to use our leverage in the health IT space to help drive adoption and do what we can. And like Pele said, when we met and were making comments on the ONC Cures proposed rule, we found some like-mindedness there, and we wanted to work together on that. I had already started working with Chris Lehman on that too, who was very influential in getting pediatrics a spotlight in the Cures Act. So yeah, that was my recollection of our relationship beginning, Pele.
That's great. And I know that, we talked a lot about how, both you and Pele felt that the ONC 10 recommendations and the Cures Act didn't quite go far enough. So, Tim, how did Drummond prioritize what else beyond the ONC 10 recommendations should be included in pediatric certification?
Yeah, so that meeting with Pew Charitable Trust was to make comments on the Cures proposed rule at the time, and before that, when the Cures rule was published, or the proposed rule was published, I've been sort of waiting to see how they were going to respond to the congressional mandate from the Cures Act on pediatrics. And while I think ONC didn't want to go too far down the road with coming up with a lot of pediatric requirements for EHRs, they highlighted these 10 recommendations, and they were broad brushed, sort of high level recommendations. So it's a good start. But I think we felt like um, there was a place and room to emphasize more pediatric functionality and some very specific things. And I was aware of the AHRQ Children's Health Format um, report that had 47 pediatric recommendations, and we felt like that was the cornerstone to start. It's actually more than 47 when you dive into it, as Pele I'm sure knows, but that's what that was the impetus for us to kind of prioritize more pediatric function beyond the ONC recommended 10.
I see.
Yeah,
Now, Pele, oh, I'm sorry, Pele, did you want to add something?
I was gonna piggyback on that because the ONC is a really great opportunity. That particular product was born out of countless of domain experts in pediatrics, right? Bubbled up to the 10 as a priority, and that itself is a big win for child health, being recognized in the 21st Century Cures Act, being promoted
Mm-hmm.
within the ONC workflow process, and this partnership with Drummond really in trying to identify even beyond the 10, like what Tim was saying, is a great opportunity that we could really define what the EHR function is for kids. And so I just want to acknowledge that even though there were 10, it's like the tip of the iceberg, that those were the beneath that is just tons and hours of effort within the pediatric community that arrive at that recommendation.
Now, Pele, you have a very deep background. You wear many hats. Aside from your role as CMIO at Arkansas Children's Hospital, you're very active in the pediatric health IT community and serve as co-chair at HL7's EHR working group. Can you tell us how Drummond's efforts to develop a pediatric certification program inspired you to do a parallel track to update the HL7 Pediatric Care Health IT Functional Profile, otherwise known as PCHIT? First of all, what is the HL7 PCHIT Functional Profile and why is it important?
Yeah, so the HL7 PCHIT functional profiles for the patient care, pediatric care, health IT functional profile is a product of HL7. So HL7 is a international standard development organization that develops standards for interoperability, but they also, like our EHR work group, develop functional requirements for electronic health records. And we've been developing functional models, functional requirements for quite some time. And one of the motivation there is really inform the general public, the EHR vendors, the end users, the healthcare community about how electronic health records function and defining the functional requirements. One of the biggest win, I think, for any of those functional requirements is that it reaches market adoption, right? So if you've developed a requirement standard, one would hope that it's being adopted in the market. So as I think Tim was saying earlier, some of the pediatric functionality weren't as adopted in the bigger scheme of things for the electronic health records because pediatric is has a small footprint. Niche products that cater to the child health community develop very deep pediatric functions, but they're not generalizable in those big national, big HR companies. So the opportunity for developing the HL7 Pediatric Care Health IT Functional Profile, it's a very long uh, uh, title, is really to gain traction in bridging the gap between standards and adoption. And I think that this partnership with Drummond showcases that, because one of the motivations for certification is really coming up with an adoption strategy that raises all boats, so to speak, in terms of functionality. And we see this as a really important partnership and a showcase of how standards are working in real time to benefit the vendors who are supporting a certain population of patients, right? As well as the community who's envisioning those functional requirements, so that then we can do a good job with taking care of our patients. So I think it's a really big win. So the goal and then the opportunity is really, can developing the standards impact market adoption forces, so that then those two can work together to develop a better product.
Pele, how long did the HL7 effort take to update the PCHIT functional profile?
Yeah, so the PCHIT functional profile project ran for about 2 years, during the COVID pandemic. But again, the work of the PCHIT really began early on in the early 2000s. So there's a lot of work that has been done by the pediatric community. A lot of informaticians work to contribute developing the grandfather, so to speak, of the HL7 PCHIT, which is the pediatric child health functional profile early on in HL7, which was used to inform, way back before meaningful use, this certification body called CCHIT, where I co-chaired the pediatric work group there, where we developed functional requirements, certification criteria for pediatric EMRs, EHRs. And then when meaningful use came, we kind of regrouped and figured out how to get into that certification. And as you have pointed out, it wasn't the main focus for meaningful use at that particular time. There were very few pediatric requirements that were able to get into the meaningful use program. And again, this 21st Century Cures Act and the ONC, took the baton and developed the requirements that we're talking about now. But in between now and when we started early on in HL7, the product that Tim mentioned, the HRQ child health format, was one of the more formal, I would say, activity that the pediatric community had developed in order to specify, you know, um, the priorities, so to speak, for the electronic health record format for kids. That's a long answer, but
It's a complicated story.
yeah.
Tim, how are the Drummond P certification? How the requirements there? How is that also related to the HL7 PCHIT functional profile standards, since they are parallel efforts?
Yeah, so I think so when we decided to build a pediatric, Drummond decided to build a pediatric certification program, um, sort of based on this children's health format that report that Pele was just talking about. We knew that that was going to be sort of the cornerstone of the requirements, and but even then, at that time, it was I don't know, 3, 4, 5 years old at that point, and so at Drummond, we're good at helping to drive adoption of standardized health IT by testing and certification, but what we really need is was the clinicians and the implementers to come together and help inform us what were good pediatric requirements and what ones were maybe not not so relevant anymore. And so as part of that, we did convene a advisory panel of pediatric clinicians and implementers and other stakeholders in the pediatric community, and we essentially sort of you know um, deconstructed the children's health uh, report all of the 47, which ended up being, when you pull them all apart, it's hundreds of requirements. And just painstakingly, over a couple of years, went over those with this advisory panel. And, as we began to formulate what would be sort of an updated set of pediatric functionality, um, um, Pele's involvement there was, what do you think about updating, the pediatric care functional profile, EHR functional profile at HL7? We were excited to do that. We felt like it was good to get all this work out into the public, and so those efforts sort of then began to dovetail, as we develop the requirements for our certification program. They naturally, sort of were able to be formulated in a way that was that became a standard that we would use for our certification program, and implementers could use, or anyone else could use, to see a set of pediatric functional profile requirements. So those efforts just sort of began to work together very easily that way.
Tim, you mentioned a couple of times testable requirements. Can you explain the process at looking at standards requirements and the secret sauce to make these requirements actually testable? What is the approach, particularly for peds?
Yeah, pretty early on, we were informed by the pediatric community that inpatient pediatrics and ambulatory pediatrics, while they shared some common ground, there was some very different um, functions and capabilities that were required there. So we knew that we were going to have two different tracks for this certification program: one for ambulatory, and one for inpatient. And then, as we sort of began to devise our sort of list of requirements, we also recognized that some requirements were what we consider shalls, which are mandatory requirements that a Drummond certified pediatric EHR would have to implement to get a certification.
Mhm.
And then there were some other requirements that kind of bubbled up from that process that we would consider to be shoulds. They should implement them, but it's optional. It might represent an advanced functionality or a more robust implementation of a baseline functionality, or something even a little bit on the cutting edge, leading edge of pediatrics that we didn't want to impose as a hard requirement. And so this differentiation between sort of baseline required requirements and then this sort of emerging set of optional, more advanced requirements also allowed us to provide the implementing EHR a way to differentiate their implementations from products from other products by how much of this advanced functionality they would implement. And we developed a scoring system to show that. And so that was a thing that was sort of lacking in for EHR products. Is it's really hard for them to differentiate themselves just from an ONC certification standpoint from another product. And this gave them a way in our pediatrics certification program to do that. And so, as far as the testable part of it is, the requirements just, we needed to be able to test them in a way. And so that became a sort of a litmus test of whether this requirement was something we wanted to include in the program or not. Was, are we able to test this requirement as implemented in an EHR vendor product?
Thank you. Drummond first launched a pilot program last year to test and get feedback on the ambulatory test scripts with Office Practicum, PCC, and NextGen, and with Pele's Arkansas Children's Hospital for inpatient to test and refine the test scripts. Pele, what was your experience participating in the pilot for inpatient certification?
Yeah, so our experience is that the testing needed to be very relevant in the care that is being delivered. I think the concept of a testing script need to apply to the clinical setting that one is testing, so that then the results of that test is meaningful to the people who are taking care of the patients, um, and so that was our experience when we um, looked at the different scripts. Our motivation was to find the clinical relevance of that, and really drilling into, okay, so if the baby was delivered here, what is the impact of the data being captured and as it's being reflected in the testing script. So um, the motivation really for us when we're testing is then, number one, does it actually support the workflow that is being tested, and number two is the result. Like, if we've passed the certification, does it have any meaning, meaningful in the clinical setting?
Pele, do you find the concept of advanced achievements, these optional tests that go above and beyond, do you think from the view of a clinician, would you find that helpful in terms of product selection?
Yeah, I would. If I'm a general pediatrician or a child health hospital, a children's hospital, or a community hospital who has significant, patient population in the pediatric age, I would like to be able to have the functionalities that are very specific to the age group that I'm caring of. So those advanced testing criteria would be of benefit if I'm choosing the electronic health record. Um, we seldom see specifics, right, in electronic health record vendors that cater to the pediatric community.
Thank you. Well, Tim, I mean, obviously there's time, effort, and expense for EHR vendors to go through a voluntary certification program. So, what did they get out of it?
Yeah, well, we hope, and the purpose, one of the purposes beyond, just trying to advance and improve child health outcomes, was to, provide a vehicle, a mechanism for EHR vendors who, are that their EHR is being used in the pediatric settings, to have a way to shine the spotlight on themselves, their pediatric functionality, differentiate themselves, sort of in the sea of available EHRs that a clinician or a hospital could, consider to purchase. And so what they get out of it, that we hope, is that there's the value of one, being recognized by Drummond as a third party, um, that is, looking at their pediatric implementation and certifying that they have they're meeting a certain set of requirements and functions, capabilities, and that allows them to, um, showcase their implementations, and, um, and so that primarily, I think that's the value that they get out of it. But I would also say, because we have, beyond just some baseline functionality and requirements, we've mentioned these advanced achievements that's part of the program. Um, we wouldn't expect, any implementation out there to walk in and be able to, have implementations for all the advanced functional requirements. So there's room, for all EHRs, even pediatric EHRs, to even provide more pediatric functionality, and perhaps our set of advanced achievements also sort of sets a goalpost for pediatrics to work towards.
We want to save a little time for a Q&A, but just very quickly, how do you plan to grow the pediatric health IT certification program, Tim?
Well, one of the things that we thought was really important from the beginning is that we had an advisory panel that helped us develop the program, but moving forward, we knew that we needed continued advisement, and participation in the program from the pediatric stakeholder community. And so we we've stood up what we call a steering committee for our pediatric certification program, and it has standards people on it. It has pediatric clinicians. It has vendor implementations and other stakeholders in the community, and they're there to help steer us in the future of what new things to add to the program. Um, and, um, and so this is something we're very excited about, is that, we don't want to just develop a program and then it is what it is. We wanted to have a sort of a living, breathing program that grows as things over time, become, you know, more relevant with pediatrics, you know, uh, and so, we want to move um, with the pediatric community on the things that's important in pediatrics over time.
Pele, what do you see your role as a steering committee member?
Yeah, again, it's a very refreshing opportunity that the child health, advocates, for health IT, EMR, informatics, now has a platform where we can contribute to improving the function really of the electronic health records overall. So we're very excited, and we appreciate the confidence that inviting us to participate. It's something that all of us, wanted to contribute, and so we're very, very eager. So, we really appreciate this opportunity. We're as excited as Tim
Thank
in
you.
this endeavor. Yeah.
Okay. We've gotten three questions. Tim, we'll have to go through this really quickly. Question one, is there any indication that ONC will formalize its 10 recommendations in the appendix of the Cures Act? In other words, will there be more rulemaking specific to pediatric care?
Um, I honestly don't think so, at least in the context that it was in the Cures rule. I mean, following up with the Cures rule, ONC did, convene some experts. They did publish some information resources, which are good, and it expands on some of their thinking around pediatric functionality. Um, but if we see more rulemaking with pediatrics from ONC, it would probably be in the context of other things in the future. Maybe ONC uh, at some point has rulemaking around social determinants of health or mental behavior health, things like that. I could see where maybe there's another emphasis on child health in the context of something else. But um, I feel like what they've done in the Cures uh, rule so far is just where they're at the moment.
Okay. And question two, what effort is involved in the PED certification testing? In other words, how long does it take?
Well, we did when we built the program. We didn't want it to be too onerous for folks to come through, because it's important for people to come through and get tested and get certified. And if the process was too long, too onerous, too resource intensive, um, folks might not, sign up and get certified. And so we're kind of keenly aware of um, trying to balance that. So we arrived at sort of about a day and a half of certification testing to go through all of our test scripts. Um, Now there may be some quote unquote homework to do, self-testing to do, and attestations and things like that in order to make sure we're covering all of the requirements that we've defined. But we were, you know, Drummond's sort of been at the testing business now for over a decade, and I feel like we had a good feel for what the market could allow. But it was definitely a factor into program design. So about a day and a half is what on average, is what we're shooting for.
Okay. We have less than a minute left. Last question. The purpose of the advanced badges and how can, the public interpret the scores?
Yeah. So, um, I didn't mention before, but and I should have, that Drummond has a list of our certified vendors that have gone through our certification program on our website. And with it, it lists a report of what they were tested for, what they passed, and what their scores were on the advanced badges. Um, and and with it, there are companion documents that readers can use to help them interpret the scores, understand the advanced badging, scoring, and just really understand exactly what a particular product was tested for in terms of requirements. And so we, that would help the public to understand what a particular product pediatric capability is.
Great. Well, thank you very much, Tim and Pele, and for the audience for sitting in our brief talk about the Drummond Peds certification. If you have any further questions, we have an end slide where you can find more information, and feel free to reach out to us. Thank you very much, Pele. Thank you, Tim.
Thanks.
Thank you.
See you, Pele.
Bye, Tim. Thanks.
Bye.
Yoko.
All right, bye.